The hidden cost of workflow instability, how information fragmentation drives downstream disruption, corrective work, preventable harm, and revenue leakage.
Hospitals operate on narrow margins, often just 3 to 4%, and yet those margins are quietly eroded every day. Delays, cancellations, no-shows, and preventable clinical errors. Not as isolated events, but as a system pattern. We assume reliability is consistent across the organization. But in reality, it varies, by shift, by team, and by time of day. What works during the day does not always hold at night or on weekends, and that variability directly impacts both outcomes and efficiency. The operating room is where problems become visible, but it is not where they begin. Most delays and cancellations originate upstream in scheduling, documentation, and fragmented communication. By the time the patient reaches the OR, the system is already compensating for earlier failures. Information does not fail all at once. It drifts quietly across systems, documents, and handoffs. Small discrepancies accumulate until no one is completely certain what is correct. And uncertainty is the enemy of both safety and efficiency. Checklists were designed to improve reliability, and they do when the underlying information is accurate. But a checked box confirms that a step was completed, not that the data itself is correct. When information is wrong, the checklist can reinforce the error, so errors are caught manually. In preoperative holding, during the timeout, at the last possible moment, under pressure, with incomplete information. This is not a reliable system, it is a recovery mechanism. Safe Start changes the sequence. A single continuously available record is created early and shared across the entire care team. It is reviewed, updated, and re-verified every time it changes, including by the patient. By the day of surgery, the record is no longer being reconciled, it is already verified. Reviewed again with the patient in pre-op and used by the team during the surgical timeout. Patients experience workflow failure long before a complication occurs. Repeated phone calls, conflicting instructions, scheduling confusion leading to uncertainty, delays, cancellations, no-shows, dissatisfaction. These are not isolated inconveniences, they are signals of system instability. When communication becomes more reliable and workflows become more coordinated, patients experience something equally important: trust. And trust drives satisfaction. That satisfaction increasingly influences patient experience scores, organizational reputation, operational performance, HCA/HPS-related outcomes, and hospital star ratings. A culture of safety is not simply policy. It is an operational discipline. One trusted record, verified before the patient ever reaches the operating room, and protected throughout the entire system.